Convulsions that occur in association with fever in your child are called febrile convulsions. These convulsions typically present in an otherwise healthy child aged between 6 months to 5 years. Most of the time, fever occurs secondary to viral infections. However, bacterial infections such as pneumonia, ear infections, tonsillitis, and kidney infections can occasionally give rise to febrile convulsions. It is very important to identify febrile convulsions distinctly from epilepsy and the convulsions that occur secondary to brain infections called meningitis and encephalitis. This is because that febrile convulsions are often not serious and settled within 5 minutes. Further, if they settle within a short period of time, they will not need any specific treatment. However, epilepsy and brain infections will need specific treatment on time to help your child recover from the convulsion. It is therefore very important to bring your child to the attention of your child's doctor if you are not sure about what is happening. Witnessing a febrile convulsion is a frightening experience to every parent. It is very important to recognize a convulsion in your child. There are several ways that you can identify a convulsion, and most of the time your child will lose consciousness and the eyes may roll upwards and you may be able to see froth coming from child's mouth. And also there can be rhythmic movements which are called jerky movements involving both hands. And sometimes your child may pass urine or feces during a convulsion. And a convulsion is likely to settle in most children within a period of 5 minutes. However, rarely and occasionally, a convulsion can last for 30 minutes and beyond. And also, occasionally, you may be able to witness one-sided movements in the body. And after the convulsion is over, you may be able to witness a period of somnolence and sleepiness that can last up to a couple of hours. Most febrile convulsions will stop within a period of 5 minutes and your child will not need any specific treatment. However, if the febrile convulsion persists beyond 5 minutes, then your child is likely to need immediate treatment. The convulsing child is kept on a side with head tilted backwards to clear the airway. All children with ongoing convulsions need oxygen and it can be delivered through a face mask. Medications called benzodiazepines are given either into the back passage or inside the mouth of your child in the absence of direct access to the bloodstream. These medications help terminate convulsions earlier. However, if the convulsion does not stop, the doctor may decide to repeat the same medication and may even administer stronger medications directly to the bloodstream to bring down the convulsion under control. Rarely, longer-lasting convulsions that go beyond 30 minutes may necessitate your child's doctor to administer medications to paralyze your child's body and put them inside a breathing machine until the convulsions are completely under control. It is important to note the onset of the convulsion as most medications used to control the convulsion are administered around the clock. Keep the child on their side with the head tilted backwards slightly as this position helps clear the airway. It is important not to shake the child and not to put anything inside their mouth or hands as this can lead to injuries. Always stay with the child and make sure the child is out of any danger. Closely watch what is happening as this information may help the doctor decide the best course of action to manage the convulsion. If the convulsion lasts for longer than 5 minutes, it's important to either call for an ambulance or to bring the child immediately to the hospital. If the convulsion stops within 5 minutes and the child recovers well, you can offer the child a drink and a dose of paracetamol can be given if it is not administered within the past 6 hours. This will also help the child kept in comfort. Keep the child very lightly dressed or take all of their clothes off if the room is warm. Witnessing a convulsion in the child can be a frightening experience to every parent. However, it is important to realize that febrile convulsions are mostly harmless as compared to epileptic convulsions. Most children grow out of convulsions beyond 5 years and they continue to develop normally. Height of the fever spikes does not indicate the severity of infection, and most viral and bacterial throat infections can give rise to very high fever. Therefore, it is not necessary to have unnecessary fears that having high fever indicates a serious infection in the child. Do not give any objects to the hands and do not put anything inside the mouth of the convulsing child, as this may result in unexpected serious injuries. Although tepid sponging and regular oral paracetamol may help keep your child in comfort, they do not prevent the convulsions from happening. Giving higher doses or more frequent doses of paracetamol should be avoided, as they increase the risk of drug poisoning. Continued tepid sponging and use of ibuprofen also to control the temperature are discouraged, as we see a lot of dengue cases in children. Although epileptic convulsions are treated with long-term anticonvulsants, anticonvulsants are hardly used and are generally not recommended in the long-term prevention of febrile convulsions. This is due to the harmless effects of febrile convulsion on your child's future and development. What is more important is to understand that most children grow out of this convulsion beyond 5 years of age. However, your child's doctor may prescribe a very short course of anticonvulsants to use during fever episode if you are extremely anxious for witnessing another convulsion. Unacceptably higher frequency of febrile convulsions, absence of a reliable caregiver to manage the child during a convulsion, and difficulties in emergency transport of the convulsing child to the hospital are the other instances where your doctor may decide to prescribe a very short course of anticonvulsants to your child. Most frequently used anticonvulsant medication is called clobazam, and it has least untoward effects such as drowsiness compared to other types of anticonvulsants. Paracetamol has no effects on management of febrile convulsions apart from keeping your child in comfort. Control of temperature is unlikely to prevent recurrences. Other antipyretics such as brufen are best avoided as they increase the risk of bleeding in possible dengue infection. The best way to prevent febrile convulsion is to prevent your child developing frequent viral infections. Regular hand washing and preventing exposure to infections by avoiding overcrowded places are effective measures that can control the spread of viral infections. If your child is having iron deficiency, treatment with iron also can help reducing the future risk of febrile convulsions. Most children grow out of convulsions beyond 5 years of age. Children with febrile convulsions further make full recovery with no after effects. Intelligence, academic achievement, behavior, and working memory are similar to children with no history of febrile convulsions. This means that children with febrile convulsions will grow up as healthy, neurologically normal individuals as they grow old. Therefore, what children with febrile convulsions and their parents need is clear explanation of these facts and reassurance. Febrile convulsions are not a type of epilepsy. They are more common and seen in otherwise healthy children aged between 6 months to 5 years. Given the harmless nature and absence of any after effects, anticonvulsants are often discouraged in treatment. It is important to use paracetamol and tepid sponging only as comfort measures, as neither will prevent recurrences. Do not use other antipyretics such as brufen, as your child may have dengue as a cause of fever, and use of ibuprofen can be potentially harmful in dengue. The most important action is to arrange transfer of your child to the hospital if the convulsion lasts longer than 5 minutes, and do not attempt any potentially harmful first aid measures. A clear understanding of the long-term harmless outcomes helps avoiding unnecessary use of anticonvulsants and achieve a better quality of life for you and your child.